Hyperthyroidism. Hyperthyroidism is a condition wherein your body is secreting excess of thyroid hormone. In other words, when you're going to do a blood test, you're going to see increased T3 and T4 and decreased TSH. What are the main cause? The main cause of hyperthyroidism is nothing but Graves' disease. How would you see? What is a patient presentation or the signs and symptoms associated to hyperthyroidism? Personality changes, which includes irritability, agitation, etc. The person would have weight loss because there is an increased metabolism. You would notice diarrhea, fine tremors, thin, soft hair, etc. Basically, your hypo and hyperthyroidism are opposite to each other. So once you learn one of these topics thoroughly, the signs and symptoms of the other one is pretty much the opposite. So it's very, very important that you learn at least one of them thoroughly. So if you're learning hyperthyroidism, it's quite easy to remember hypo as it's the opposite of hyperthyroidism. However, the most distinguishing feature of hyperthyroidism is exophthalmos, which means you have bulging eyes. It is very characteristic. You would notice it right away as soon as you see the patient. You would notice that their eyelids are like really bulged, and that is indicative of hyperthyroidism. Management of hypothyroidism is usually based on what symptoms the person presents. You would advocate for adequate rest. Make sure they have high calorie diet because they're having low weight loss. Propranolol is given for tachycardia. Avoid giving stimulants because your body is already in hyperthyroidism state. In addition, you're going to give iodine preparations and medications that are going to lower your thyroid levels. The medications that lower the thyroid level are methimazole and propylthiouracil. We were talking about exophthalmos, which is a common symptom which is associated with hyperthyroidism. If your patient comes in with exophthalmos, it means their eyes are really bulged. How are we going to manage that? Make sure they have eye drops to make sure that their eyes or the eyeballs are not dry. You can close the eye for the night and even tape it to make sure that the body gets adequate rest and ulcers are not formed in the eye because it's dry. In addition, you also tell the person to elevate the head end a bit to a max of 10 degrees, and you provide them with low salt diet. So that is management of hyperthyroidism.